Hi, it's Dr. William. Pull up a chair. We got a lot of things to go through. These are 18 things not to do if you're having a breast augmentation. Number one, after you've had your breast augmentation, don't ignore your breasts. If you do, they will become painful. You're going to want to touch your breasts right on the day of surgery. You're not going to break them. Make sure you touch your whole breast, touch your areola, and touch your nipple. Touch all around, just gentle light touch so you don't get really hypersensitive nipples, and that can cause you a lot of pain. Number two, don't massage your breasts after surgery. We used to tell patients this years ago to massage their breasts. It doesn't really do anything. It's unnecessary. We don't need you to manipulate the implant. Leave the implant where your surgeon put it. Don't massage your breasts, but do touch them. Number three, don't get saline breast implants. There's two types of implants by and large, silicone implants and saline implants. I think the silicone implants are much better. Most patients in the United States get silicone implants. They're softer, they look better, they feel better. They're not as hard on your tissue as a saline implant. Number four, don't get a textured implant. You're going to want to have a smooth implant. The textured implants is where they're referring to the surface of the implant, to the top part of the implant that can be textured. It can have a little feel to it. That implant has been associated with a very rare form of cancer. We don't use them anymore. Some places still do. Do not get a textured implant. Number five, don't get a peri-areolar incision. So don't talk your surgeon into trying to do an incision around the areola. You have to go through the breast when you make that type of incision, and you can contaminate the implant because the breast is still open to the air through the little ducts that go through the breast gland and then go out through the nipple. And so we consider the breast gland to be contaminated. And so you don't want to have a peri-areolar incision, and then we have to go through the breast and put your implant in, and then you get the implant dirty. So don't have a peri-areolar incision. Number six, don't choose your implant size off Instagram. Speak with your surgeon. Have your surgeon determine however they determine the implant size. For me, I use a very simple system. I create the pocket, I measure it, I use a sizer, and then I select the implant based on that sizer. I like to get a very full kind of engorged breast. I like that look. My patients that have breast augmentations with me, they like that look. It's not for everyone, but don't pick an implant size off of Instagram. It may be too small for you. It may be too big for you. Let your surgeon help you pick the right size implant for you. Number seven, if you're 40 years old or older, or you're approaching 40, don't forget to get a mammogram before having your breast augmentation. Number eight, don't worry about getting sick from your implant. Implants do not make you sick. We have thousands of patients that have undergone studies for many, many years, and there's no evidence in our literature that links any sickness with having a breast implant. Number nine, you don't need to wait until you're finished having children or you've had kids to get your implant. I hear this a lot, and it's just not true. You can have your implants before having children. It's not going to change what happens to your breast. Your breast after having a child is very variable as to what happens. Some patients can have 3 or 4 children, nurse all their children, and their breasts don't look like they've had children at all. Other patients, the opposite. They don't have children, and 10 years later their breasts are very droopy. It just, so much of it depends on your tissue, how much breast tissue you actually have in your breast, how that responds to the hormones. Not everyone's the same. So I don't think you need to wait until you finished having kids in order to have a breast augmentation. Number 10, don't forget to talk to your surgeon about implant profile. I think this is very important. There's different types of profiles of the implants. In general, there are 3 different sizes. Basically a low profile, a medium profile, and a higher profile. In my practice, what I tend to use are the higher profile implants mostly, sometimes a moderate profile. In a general sense, there's more complicated than this, but in a general sense, you can Sort of think of it as the higher profile implant is going to give you a much fuller breast, a much rounder breast. A lower profile will give you a more quote-unquote natural looking breast. It's much flatter than a high profile implant. These are all about the same size. They're all filled with about the same amount of silicone, but it's just how the shell is shaped. Because remember, an implant is just made up of a shell on the outside, silicone shell, and then they fill it in the factory with the silicone. So you can put the same amount in different types of shells and you get a different shape. So don't forget to talk to your surgeon about profile size to see what they typically do. Remember, the profile of an implant does not mean anything about up high. The profile means projection. So how much the implant, how much your breast is going to be projecting from your chest. High profile does not mean you're going to be high up here. Number 11, don't forget to check if your surgeon is board certified. So there are quite a few doctors out there performing breast augmentation that are cosmetic surgeons or other types of surgeons. They're not truly plastic surgeons. And then some plastic surgeons that have done plastic surgery training are not board certified. It's very easy to see if your surgeon is board certified. Just go to the American Board of Plastic Surgery, type in their name, their state, and you'll be able to find out whether they're active. Number 12, don't forget to use an easy bra after having a breast augmentation. Now, most people probably have not heard of an easy bra. It's a fantastic bra. I use it in all of my patients. It's really a dressing. It's a sterile bra. We put it on in the operating room, and then you change that dressing every day for the first 5 days. It's just a sterile dressing. You take it off, you throw it away, you put a new sterile one on. It has nice bands, so it keeps the implants exactly where you want them, where your surgeon put them, and it prevents the implants from bouncing around, which can produce bleeding. So don't forget to use an easy bra. Number 13, after you've had a breast augmentation, do not ignore any redness, swelling, pain. Those are all signs of an infection. Infection of a breast implant is really devastating because we have to take the implant out, leave it out for a few months, let your body get rid of the infection, and then we replace the implant. So nobody wants to go through an infection. It still happens no matter what we do with cleaning the skin, antibiotics, everything else. It's not very common, it's less than 1%, but don't ignore any redness or pain of your breast. Don't wait, contact your surgeon immediately. If there's a little redness that's just in the skin, sometimes we can catch that infection with antibiotics and prevent the infection from going deep into the breast pocket. Once the infection is in the breast pocket, the implant has to come out. So don't sleep on any redness. Contact your surgeon immediately. Number 14, don't do any heavy lifting for 6 weeks. 6 weeks is always kind of the golden number about healing, and that's when your wound strength is strong enough. So at 6 weeks, you can do heavy lifting. I like my patients at 3 weeks to do some light activity, running on the treadmill, do things like that, and then gradually ramp up the exercises from 3 weeks to 6 weeks. 6 weeks, do whatever you like. Number 15, don't fall into the trap of thinking that you have to have your breast implants changed every 10 years. You do not. That is not a correct statement. I think everybody believes it when they come in. The only time you need to change your breast implants is if you have a problem. The most likely problem to have is what we call capsular contracture. That happens in about 3% of patients where the breast can get hard. It's not a medical emergency, but it's most likely a reason why you'd have breast surgery again. But if everything's going well with your breasts, they're soft, you like the size, you like the way they look, there's no droop, everything's going fine, and you're 10 years out, you don't need to just go in and change implants. 16, don't forget to use your arms. This is something I see all the time where patients will come in on the next day of surgery and they'll be the robot where everything is very still because they don't want to move their arms because their mom told them, don't move your arms after having a breast augmentation. That's wrong. I want you to move your arms after having a breast augmentation. Don't be doing jumping jacks but you're going to want to do normal movement where you're moving your arms. You can wash your hair, you can reach for a coffee cup, you can close the door, you can use your arms normally just like you typically would. We don't want you doing vigorous exercises with your arms, but the problem is if you don't use your arms, and I've seen this several times, where patients can have what we call a frozen shoulder, where their shoulder actually gets locked into this position and they need to have rehab to be able to regain the use of their shoulder. So don't do that. Just light, gentle movement, just using your arms normally will prevent any problem. Number 17, don't forget that you can sleep on your tummy after having a breast augmentation. There was a surgeon who's passed away now. He always used to have all of his patients sleep on their tummy. He wanted them to get used to the feeling of having implants. There's no damage sleeping on your chest after you've had a breast augmentation. If you're a tummy sleeper and that's the only way you can really sleep, then that's fine. You can sleep on your tummy after having a breast augmentation. Number 18, don't forget to take care of your scars after surgery. Beginning at about 3 weeks, that's when I have my patients do it, is massage your scar with some type of silicone-based scar cream or gel. You're going to want to massage it in little circles, and you're going to want to massage your incisions in line with your breast. That's how you're going to get the very best scar. If you add in silicone sheeting for the first year, where you can wear these little silicone strips on your incisions, that and the scar gel will give you your very best scar. So don't forget to pick up your scar gel and your silicone sheeting before having surgery. Those are the 18 things not to do. If you like these videos, please comment. I'm happy to answer any questions. It's a source of more videos for me. It's also a source of laughter because people say great things on there. And like and subscribe. Turn on your notifications. You'll get notified of future videos.